quick rule of thumb is the average ED admit costs $30,000. For $30,000, you can feed someone Epicured 21 meals a week for 24 months.
Crazy.
Richard Bennett, CEO and co-founder of Epicured. Thanks for joining me as always.
Logan, it's always good to be with you. Thanks for taking the time.
So we're talking a lot at Startup Health about the idea of food as medicine. Recently at Vive and at HLTH, there were entire pavilions dedicated to this idea of food as medicine. It's not a new idea, but it's certainly something that we're spending a lot of time talking about. And we just launched the Startup Health Food as Medicine Moonshot, which you're a part of. So I want to just start with this idea that you are really actually doing this work, where you try to conceptualize what it means for food to be medicine. It feels like what you've built at Epicured is at ground zero. So just break it down for us, what you've designed, what you're building, and kind of give us a sense of where you're at in the evolution of the business.
Absolutely. Well, it's really an exciting time for food as medicine, which means it's an exciting time in healthcare and for individuals to really get healthier again in the United States. For us at Epicured, we've been building Epicured for 9 years, so we're not new to this market. And we've been working and doing our part to really enforce the importance of the role of food as medicine, registered dietitians, nutritionists, chefs, and how we can help people live healthier lives and really think more around whole person care. And if you go back to the inception of Epicured, we started talking about Epicured in 2006. We founded it finally in 2016. And we've been building the company from a local brand to now a national brand. And we actually have our first international project that we're launching too. So it will be global before you know it. But if you keep it contained to the United States and where clinical mindsets are, payer mindsets, consumer mindsets, they're all aligned on the benefit and the role of food as medicine to really tackle some of our biggest problems.
So let's break down the actual product then. We've talked about the theme. So how do you use food as medicine, and what's sort of broken about the way you see how this has been handled over the last couple of decades?
Well, if you really go back to the root cause, what's been broken is in a post-industrialized society in the United States, you had healthcare and food, the two industries, right? Totally divorced from each other and almost working at odds. Healthcare didn't understand food and food didn't understand healthcare. Food was calibrated after the world wars around feeding the most people with the cheapest calories. And it was about avoiding famine. But the way we approached that in food actually triggered a tremendous amount of chronic disease burden in the societies that were using that methodology. And while healthcare focused on longevity of life generally and extending life expectancy and using pharmaceuticals and acute care interventions, that allowed kind of chronic disease to really become a problem. And for a long time, healthcare didn't know how to handle that. We had a real fee-for-service model. Value-based care wasn't a thing. Doctors weren't trained in nutrition. So you had this context, this petri dish for a perfect storm, which is now completely changed in people's mindset. And people are making real structural changes in the industry to make it more accessible. At Epicured, we started the company focused on digestive disorders, where we made medically tailored meals for people who had Crohn's, colitis, SIBO, celiac disease. And our go-to-market strategy was B to B to C, where we would go to physicians who would prescribe Epicured to their patients. The patients would become consumers, and they would go to epicured.com and they would buy and pay for Epicured on their own dime. And we know that that's a good model because it demonstrated the quality of our product, that people wanted it. It was our foundation point to show that we could pull this off. But the big problem it's not accessible. I think we'd make a very fair and produce a fair price point, right? Even these days with inflation, our price points comp to McDonald's and Chipotle dining experiences. But that's not how you can get to a Medicaid population or someone who's food insecure. And so how do we look at that, knowing that those populations have an undue burden of chronic disease and also drive a disproportionate amount of cost into the system? So that structural change is really where we've been focused on and made a lot of progress just in the last year.
One of the things I find fascinating about Epicured is that you're also building on current market trends, or at least trends over the last 10 years in terms of meal prep, food delivery services. You're kind of tapping into the cultural understanding of meals being delivered, but you're doing it with this healthcare angle. Where are current attitudes right now in terms of consumers understanding and welcoming the idea of food delivery and kind of working with a company like yours, buying their meals online and having them brought to their home?
Well, for us, I think the biggest trend is across the generations and age groups, people understand more and more what you put in your body is going to change how you feel. It's going to change how you are able to live your life. And it's not just about pure enjoyment or, satisfaction with what you're eating. And it's also become a little less cool to eat the fried foods, right? And so there's been a good amount of peer pressure societally to think about, where does the food come from? What is it doing to my body? What is it doing to my children or my mother and father who I'm supporting? And there's more thought that goes into it than ever before. And therefore, people are willing to spend their time and dollars differently to get a different outcome because they've seen that the outcomes have been pretty poor. And people are beginning to correlate that the outcomes being poor tie in with the daily decisions of what you're putting into your body.
So getting back to this idea of selling into Medicaid and changing the payment structure, what are the kinds of validation points that are necessary to make a sale like that?
I think, and we stand on the shoulders of giants, and we've worked with clinical researchers, academics, policymakers, lobbyists who've been working on this for just as long or longer than we have. But the concept is that it needs to be covered and reimbursable. And that's what we've finally hit. For us, we signed our first reimbursable contract in December of 2023. And so we've been implementing that in 2024. And then we signed 4 Medicaid contracts in Q4 of last year that we're implementing now. And both of those, one is focused on an elderly population in a PACE construct, which is the program for all-inclusive care of the elderly, which is often a vulnerable population and socially isolated and not cared for as well as they could. And then Medicaid broadly is designed to take care of our most vulnerable Americans. And so our ability to do so and to pull that off, what we had to do to just double click is move just from digestive disorders to cover a wider range of therapeutic nutrition needs. So we cover cardiovascular disease, renal disease, pre and post pregnancy, maternity. We focus on diabetes, and then we focus just on what we call core nutrition, which is mostly targeting a food insecure audience who luckily hasn't acquired a chronic disease yet, but that we're really trying to get them back on track.
Break down these actual contracts with me in terms of who's getting the meal plans. What are these populations like? How much of it is covered? Is it completely covered? Is it only for people with certain diseases that have been referred? Kind of break down some of the details of what a Medicaid Epicured partnership looks like.
So our Medicaid contracts right now are centered in New York State. And the way every state is slightly different. So I don't mean to speak nationally, but they're building on each other. North Carolina did a program. California learned from North Carolina. New York learned from California. And we've been signing contracts in New York today. So my comments are within the context of New York, but are broadly applicable to the trends of what's happening at CMS, about how CMS looks at Medicaid. For us, we have 3 types of services now, not just meals. We do registered dietitian counseling. We do medically tailored meals. We do clinically appropriate meals, which is back to that core nutrition. You might not have a disease, but you need something a little bit better for you. And then we do produce and pantry boxes. And kind of what happens is we assess and work with our Medicaid partners on who needs what, right? And are you able to cook? Can you stand up? Have you had a total knee, 2 knees done? Do you have a hip? Do you have walk with a walker? These are certain things that we look at the social factors and the clinical factors to prescribe you the right program under the Medicaid reimbursement. And no matter what route you take, though we get you covered for 6 months of meals, minimum 21 meals a week equivalent in ingredients or in actual meals. And then depending upon your status at the 6-month mark, you're able to be reauthorized twice. So we could be working with our patients, our members for 18 months. So this is the most longitudinal intervention with nutrition ever in CMS, Medicare, and Medicaid. And we're really proud to have been selected as a leading partner to bring this to life.
Okay. In terms of the sort of killer statistics that make this possible in a contract like this, do you have to prove to them that you're going to save them money in the long term? It's better if you're healthier now, you're going to save these unnecessary ER visits, et cetera, or you're doing it because everyone in the partnership knows this is the right thing to do and this is going to make people healthier, full stop, and let's just start the program and then study it afterwards.
So this is built in. North Carolina demonstrated that this was effective, and we learned from there. California
effective at doing what?
At lowering emergency department admissions and readmits, improving student health outcomes overall, and therefore generating a positive economic ROI. Okay. The way quick rule of thumb is the average ED admit costs $30,000. For $30,000, you can feed someone Epicured 21 meals a week for 24 months. Right? And if you start to look at that cohort, right, as an actuary or, at an insurance company, especially if we're hotspotting with the most vulnerable and working and activating and engaging members who are most at risk, that ROI turns around really quickly. And so we've already learned that in the industry. So in New York, we want to re-demonstrate that. We want to measure that always. But that's already been proven to generate a positive economic outcome for the system, while also generating a positive personal outcome for the member with their health and quality of experience.
I'm fascinated by what you said about bringing in the nutritionists. I talk to a lot of founders who are working on their little slice of health innovation. And oftentimes what they're really doing is they're looking for a foot in the door, and then they want to wrap around other services once they have a relationship with somebody. And so I'm always sort of curious, like, what is going to be the thing that builds the relationship that then allows you to have a more holistic health experience? And I hadn't really thought before about the power of food as being that foot in the door, that relationship that's multiple times a day, that once you have the relationship, you start thinking about, okay, well, what other kinds of services could I get? Do you think of it in that way? Or do you see yourself sticking more specifically to food and meal delivery and then just maybe a nutritionist add-on?
No, I think you've gotten to a big point. Your listeners and readers I know a lot about healthcare, so it'll resonate that trust is unbelievably important in healthcare. And our ability to build trust through filling a care gap in nutrition allows us to open up a dialogue around transportation, or around housing, or around economic insecurity for the need of a job, right? And so all of these tie into your social determinants of health, but you can't really build the trust on housing, transportation. The best benefit to lead with is around nutrition. And so we use our 21 meals a week as 21 touch points. And then we make sure that while we're engaging them with the delivery confirmation, oh, look what you're getting next week, Logan, with your meals. Oh, you met with our registered dietitian. We have a whole concierge team in our call center. And so we now have a relationship with Logan that the insurance companies or even the physicians don't have, that we can then use to say, great, Logan, I hear you've offered to me, right, that you love the food, but you're having a hard time getting to your next doctor's visit. Let me navigate you to our transportation partner. And you're beginning to really do whole person care using food, the power of food and the relationship there, to then you're cracking that nut. We've built trust with you. We've built the relationship. And so we're really a relationship first company, and we use food to build that relationship.
Shifting gears slightly, about how many meals do you provide in a period of time, a month, a year?
Well, it's ramping up with these 4 Medicaid contracts, right? I mean, so we are growing at the moment at about 20% week over week in meal volume, and about 50% week over week in produce prescription volume. So we're at a major inflection point as we roll these contracts on.
And And those are just a couple of contracts. So I guess my question is around the opportunities and challenges of scale in a business like this, given how big the market really is.
And there are two different lenses. One is kind of from a shareholder lens, and one is from addressing the need, right? So no one company in the United States is going to be able to address the entire need. Unfortunately, it's just that large. So when we look at New York State, we have 4 contracts. There are 9 up for grabs, right, in total, right? Because they divide the state up into 9 different regions. We have contracts with 4 of them. We're working with the other 5 to get those contracts. For us at Epicured, we've built this company very methodically to be also vertically integrated, which we haven't touched on this call, is we actually make the food.
Yeah.
And mind folks, when people look at food as medicine companies out there, almost none of them make the food. They outsource the food to a co-manufacturer or a co-packer or someone else. So we built a healing foods facility in an opportunity zone where we generate 70 jobs and growing for economically insecure people in that community. We bring in Michelin-starred chefs, registered dietitians, operations, supply chain folks. And so we built this capacity. And at the moment where we sit today, we could 10x our volume and still be within that facility.
Wow.
But really our ability to make that facility the template and then replicate that elsewhere as contracts need, or even as some of our quote unquote competitors or channel partners call us up and say, hey, we have a contract, but we don't make the food and we can't see anyone who makes the food as well as you, aligned with clinical and cultural guidelines, right? Then that's another growth opportunity. So one's from a policy perspective, we need a lot of people around this problem, right? Because it's just so big. And then from a shareholder perspective, right? Our ability to scale and grow is really unique, and we have a great position in that market.
In terms of your growth strategy, are you going to go all in on this Medicaid population, or will you continue to? There's millions of folks just on the internet who would benefit from, a meal plan from Epicured. I've tried it; I love it. I mean, your market is huge, even outside of Medicaid. So, are you going to focus in on the one? Or is it an all of the above approach?
No, it's an all of the above approach. I mean, that's part of where we built up this process so that we could take care of as many people as possible. So we have our self-pay business that it will continue on self-pay right now. You can't access our diabetic or renal menus. We've only developed that for Medicaid. But now we're repurposing that whole process and all those products to go onto Epicured.com to help diabetics who aren't on Medicaid, as an example. And I think that's important for us to really take a beat on for a second. At Epicured, we have one standard of care. Whether you're on Medicaid or you're paying for it with an Amex Platinum card, you are getting the exact same product from the exact same facility, and everyone will eat the same quality food. And what we're doing is creating this virtuous process. And we've been talking with Medicare Advantage plans, and other things. And to be a Blue Cross Blue Shield member, you might get a rate at Epicured, right? That's way lower than just a self-pay rate, but Blue Cross Blue Shield will need to pay for it, right? As an example. So the insurance companies are really interested about how do I intervene? But I also don't think insurance companies should pay for food forever. So how do you off-ramp people in the right way to get them to be self-sustaining? I think that's where our self-pay business and our enterprise, our contract business is very virtuous. And that ties into also, we'll be launching FSA and HSA eligibility. So people can use different types of dollars, flex card access. There's billions and billions going on to flex cards. So it's very cool in how I think we're approaching it.
It seems to me that one of your moats in this building, in this company, is that it's a complex business that you're describing. And so I'm curious, what are one or two things that from your past before Epicured that kind of feed into this work and make it possible for you and the team to accomplish something at this scale?
Well, we have a great team. I mean, first and foremost, we've been able to recruit the best and brightest from culinary to clinical to supply chain management to operations. So the most important thing I do is to pick the right players to bring into the company and keep them there. And our goal is to absorb the complexity for our members, our customers, our patients, so that they can handle the challenges that they're facing, right, around their disease state or around their economic challenges, and that they can return to the joy of eating. For me, I mean, my background was in Northwell, in supply chain management, revenue cycle management, hospital administration. And then I founded the venture fund and we built consumer health and wellness businesses. So I've always loved this intersection of a consumer mindset and a patient mindset, right? And now for me, I've always been on the healthcare side, but now I get to look at the culinary side and the clinical side and how we bring them together. And we're really proud. One of our clients asked us to develop Liberian dishes so that we could help penetrate a specific population in one of these Medicaid contracts. And so we do El Salvadorian, we do Puerto Rican, we do Liberian. And I love the concept of food as medicine, but I like to underscore that food is not a pill. It's social, emotional, cultural. And it's a pretty dystopian world where we're all sitting down to eat our pills together. Like, that's not the future.
Yeah.
So we need to really harness the power of that. And we bring that to life in a really cool way.
How are you seeing your work impacted by trends through like GLP-1 uptake and just the way it's shifting people's thoughts about their own nutrition?
Well, obesity as a condition and clinical weight management is really something we've not been involved in up until this year. Unfortunately, weight management and the diet industry in the United States, 95% of diets end up in weight gain and worse health outcomes. And so we have some really good partners that we haven't announced yet, where we're going to be rolling out a clinical weight management line that also wraps around and thinks about GLP-1s. I've been very cautious there so that we do it the right way, because we've always been evidence-based, science-focused, and not chasing fads. Now, GLP-1s are no fad, but our approach to it, I really wanted to be conscientious about how we would go to market around weight overall. And so more to come on that topic.
Well, you said you're growing rapidly in terms of the number of meals you're making. You've got these new Medicaid contracts. What are you most excited about coming out over the next 6 to 12 months? What should we be looking forward to?
I think one of them, maybe we can even have you intersperse it at the end. But what we like to see is the testimonials coming out of our Medicaid community right now, and how they're feeling and how grateful they are, and just how wonderful they are to be with. So that's what we're most excited about, is really investing in those communities around New York State. And building those relationships. And we're learning a ton and creating that feedback loop, because we're very proud of the product we have today, but everything could always be better. And that's where we're really focused for the next 12 months, is on that particular journey.
Do any of those testimonials just come to mind, ones that have stuck with you?
Great food, great service, thank you, right, is the general gist of it. And it's really, really powerful. So I won't, we'll put those up for you and you can think about how we can get the message out, right?
That's great. That's great. Well, I love what you're doing, Rich. The food side is one thing, but then these healing food centers where you're actually, vertically integrating is so fascinating. I didn't know that you were at the place where you could 10x capacity at these centers. And so in terms of scale, that's really interesting to see your ability to meet the needs of these Medicaid populations and then some. So it's going to be exciting to see how all of that plays out over the next year. Excited to see you grow.
Well, we're really grateful to everyone who's been involved on the journey. It has not always been an easy journey. So to my fellow entrepreneurs out there, stick with it. And if there's anything we can do to help or collaborate, we have an open door policy and a big tent policy at Epicured. So we'd love to keep collaborating.
Elliot, speaking of fellow entrepreneurs, I know you're a member of our new initiative, the Food is Medicine Health Moonshot Community. Just maybe you could share a word about why it's important to collaborate with folks who have this similar passion, as everyone's sort of working out their piece of the puzzle.
Well, I find my fellow entrepreneurs to be just so inspiring and so reinforcing to what we do every day. And the idea that Startup Health is creating this forum around food as medicine, I just was so excited by it, because my relationship with Startup Health has been so reinforcing and encouraging over the years of what can be hard days, right, as an entrepreneur when you build something from scratch. And the idea that we can work together, whether on the technology side, on the healthcare services side, on the culinary side, on the activation and engagement with the members side, I think I've just learned a tremendous amount. And the power of that group is something I'm excited to be a part of. I will contribute whatever I can, but I always walk away feeling like I'm taking more than I'm giving, which is a blessing.
Yeah. Awesome. Rich, thank you for taking the time and giving us this update.
Hey, Logan, thanks for having me. Always good to see you.
You too. All right. Be well.
Now, before we get into that, a quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.